Hi, I'm Mary Jo. I've been a nurse for 50 years. I have lost over 100 pounds as a postmenopausal woman. But what's even more exciting is I have reversed chronic disease in my life, specifically things like hypertension and migraines. The fact that I was chronically hypertensive indicates that I was heading for a cruising as far as heart disease is concerned. But I feel like I have totally averted that. Even my wonderful father had like a triple bypass surgery. I believe he was in his 70s at the time. And heart disease, when I did some research on it a couple of years ago, killed 51% of Americans that died. So I think it's a worthy topic. Most Americans have heart disease. Dr. Joel Fuhrman has stated in some of his lectures, if you eat American food, you will get American diseases. And in the United States, people over the age of 60 not only tend to have one chronic disease, but oftentimes two or multiple chronic diseases. Of course, diabetes, kidney disease, and cancer, as well as heart disease, all seem to occur simultaneously in certain situations. And the problem being that the American diet is high in animal products and processed foods. Now, the animal products we are offered today, at least conventionally speaking, has a large amount of saturated fat. And I think this begins the discussion on the development of arterial plaques, which lead to hypertension, heart disease, peripheral vascular resistance, and actually kidney disease and dementia as well. I mean, limiting blood supply to certain parts of the body due to atherosclerotic plaque does eventually over the years create havoc. And as cells dysfunction, if you don't have any nutrients that will allow them to regain some function or recognize cells with damaged DNA, then those damaged cells continue to proliferate, and that can cause a series of chronic diseases. You know, it's kind of scary because there was a Framingham heart study, the Bugalosa heart study, and both of these had autopsies related to people who died in accidents. I believe in the Bugalosa study, children 7 to 11, 75% had the development of plaques. I mean, good gravy. What is that all about? That should not be happening. That's kind of a scary thought. Now, they aren't symptomatic of disease, definitely not. And it's going to be a while before they become such. But if you have the beginnings of atherosclerotic plaque when you're 7 years old, where are you going to be when you're 60? Huffing and puffing with severe angina, trouble thinking and walking, and among a cast of other problems as well. So there were autopsy studies of Vietnam veterans. The average age was 19 and a half. And they found like 80% plaques in these gentlemen, even though they were non-symptomatic. As you get older, the percentage of people with plaques, coronary artery disease, hypertension continues to mount up and away. Even my ex-husband had recently had bypass surgery, and I just felt so bad for him. I feel like I'm sitting on magical information that can reverse heart disease and wasn't able to share it with him. Not that he necessarily would be open to it, and people have the right to make whatever choice they want in this world. There's no doubt about that. So, if you eat a diet high in animal products and refined sugars, then you create cells that can easily break down cross-linked DNA, cause different mutations to occur. And the refined sugar also creates havoc. Now, between refined sugar and animal products, you're going to have an overload, an increase, but not just an increase, too much insulin and IGF-1. And these chemicals, when they're exceptionally high in the body, especially in adults, are growth hormones and lead and aid to a situation called angiogenesis. Angiogenesis is the growth of blood vessels. Unfortunately, this allows blood vessels to grow into fat cells so the person can get fatter, to grow into and spread cancer cells throughout their body if they have developed, and it also is instrumental in plaque development and the obstructive diseases that can accrue, limiting oxygen flow. Now, one of the big reasons, as I indicated earlier, for plaque development is saturated fat. It is not the only one. Let's face it, high saturated fat diet and refined sugar work together to create havoc. You can't say it's just one or it's just the other. Part of the problem with animal products today is how they're conventionally raised and usually fed an atypical diet, which is increasing their omega-6 content and their saturated fat content. But high saturated fat, I think, goes hand in hand with the development of atherosclerosis, which is often symptomatized by heart disease, but it also creates a plethora of other chronic issues as well. There can be a lack of nitric oxide as we get older. Okay, why is that? Well, when you're children, you have enough nitric oxide synthase hanging around that you can create a lot of nitric oxide in your circulatory system, which is going to help prevent some of that plaque development. But when you get older, that goes down. So how do you get more? Well, there's green vegetables is the primary way, because greens and like beets, vegetables like beets, they're arugula, cruciferous vegetables, they all help your body produce nitric oxide and NRF2. NRF2 is a transcription factor, and it produces a thorough, complete, total body antioxidant response. So when you have different kinds of chemicals floating around that are toxins to your health and could encourage these types of diseases associated with inflammation, you then have the ability to neutralize them. I think that is absolutely wonderful. So greens are really, 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 really important. They do several things, which I may have mentioned in previous conversations. They can correct DNA. If it's been damaged, they can identify this cell is not repairable. Please get rid of it. And the immune system will. They can encourage the production of nitric oxide. Remember, in the presence of normal flora of the mouth and a hydrochloric acid in the stomach. They work together to allow this to happen. So it diminishes inflammation, it diminishes opportunity for heart disease, it allows the blood vessels to become like silicone. That's not correct, the way I said that, not physiologically correct, but it makes the surfaces smooth, and it doesn't allow plaque to adhere, and even allows it to go away. I was hypertensive for quite a number of years. My blood pressure is totally normal. 110/70 is my morning high. It's sometimes more like 90/60. And so what that's telling you is somebody who had documented hypertension, eating a nutritarian style plant-based diet reversed the plaque in her body, has great cardiac activity. My heart rate, in fact, I have this fitness watch that sometimes tells me my resting heart rate is too slow. Well, it's not too slow. It is normal for a heart rate, because your heart is so powerful, working so well. So when you have a very healthy heart, it's normal to require less beats per minute to get excellent perfusion. Even people who exercise on a plant-based diet, let's temper it with a nutritarian flag as well, can sometimes have a bit lower heart rates. Yes, it's going to go up with exercise. That is to the good. But it does not become excessive or dangerous. And these low heart rates are just usually great evidence of health. So, nitric oxide creation and NRF2 work together in complicated, intricate fashions and are extremely important to dissolving atherosclerotic plaque and to prevent its further occurrence. So how do you prevent heart disease? Well, obviously, a diet based high in greens and cruciferous vegetables is certainly going to be a great assisting factor. Dr. Esselstyn tells his patients who are cardiac patients that he wants them to have 6 servings of greens or cruciferous vegetables a day. And he has quite an interesting plan to accomplish that. What is a serving? Well, you need a really healthy big handful of cruciferous vegetables. And remember, like if you were to take some kale and you were to steam it, this big handful of kale becomes kind of small. So Dr. Furman likes to say, eat a double serving of some form of steamed greens or cruciferous vegetables, because his concern is you get enough of this really high potent food product to assist your body for repair and creation of great health, to allow you, for as long as you are alive, to live the life you wish, which is just wonderful. Ways that you can know you're safe and protected from heart disease include the following. First of all, there's nothing kind I can say about toxins such as cigarette smoking. It really destroys your blood vessels. So you just have to figure out a way to quit. That's all there is to it. You have to quit. Now, if you are overweight or obese, you're not protected from heart disease. Well, how do you change that? Well, eat a high nutrient dense diet full of fruits and vegetables, some whole grains, and some, not too many, nuts and seeds, depending upon your caloric density need. And with those vegetables, you need to include onions and mushrooms. And with the fruit, berries, pomegranates, and cherries have your highest nutrient value. Does that mean you shouldn't eat an apple? Good gravy. I love apples. I have one almost every day. And the skin of the apple has this wonderful chemical called quercetin that really aids the body in its health journey. So I am all for apples. And onions also contain quercetin. Isn't that interesting? And strawberries contain something called fisetin. And it's the one food product I know that contains a significant quantity. Once again, it's one of those flavonoids that bring health and joy. You like that to your life? A little improvising there. Okay, how else do you know? Get your weight under control. It's not as hard as you think unless you say, I can't do that type of eating style. Then it becomes very, very difficult. Because if you're trying to eat moderately only and you're not getting enough nutrients, your body is always going to be hungry. I've been there, done that, and it just drove me nuts because I couldn't stop eating because I was constantly starving. But now that I have a body saturated with a certain number of nutrients, I have the freedom to go do whatever I want, whenever I want. and I don't get shakiness or fatigue or this anxiety that says you got to eat now. That has all gone away, and it's such a release. I love it. So you can also look at parameters, and those to be blood work, such as your cholesterol, HDL, LDL, triglycerides, your blood sugar, and what about your blood pressure? So if you have normal blood pressure without medications, you are very protected from heart disease. But you have to have associated with that a normal cholesterol level. According to the Framingham Heart Study, really, a cholesterol level that would prevent or you would suspect would not allow a heart attack is below 150. Yes, below 150. Below 200 isn't good enough. People who have a cholesterol level of 192 in this country tend to have heart disease. So the Framingham Heart Study said it was people below 150 for a total cholesterol. I don't have good numbers for LDL and HDL. HDL, a high density lipoprotein, takes cholesterol away from blood vessels and takes it to the liver or the GI tract for excretion. So it's called the good cholesterol. My maiden name was Hill, starts with an H, so I always say OH, Hill, DL, good cholesterol. LDL is low density lipoprotein, and it carries cholesterol to the blood vessels, which encourages the development of plaque. But the type of LDL that is most dangerous is called very low density. Very low density. And that means it's LDL that has oxidized. When something oxidizes, it creates free radicals, it loses electrons, and it acts very, very, very unstable and creates inflammatory havoc in your blood vessels, as probably for the most part in your blood vessels. So you want normal cholesterol, you want normal triglycerides. Now triglycerides, even though it talks about fatty acids in the body, it is highly related to sugar and processed food. So a high triglyceride level is an indication of too much junk eating. And high cholesterol and LDL, especially low density LDL, is an indication of too much saturated fat for the most part. And high HDL is a positive that can help diminish the insult of the other numbers. So are you protected from heart disease? Well, you are if you are normal weight or you are achieving a normal weight. You are if you're not smoking and avoiding toxins that create havoc in the bloodstream. You would like to have a normal cholesterol and cholesterol indices, and that's not exactly USA normal. That's Framingham Heart Study normal. And a normal triglycerides, and a normal blood pressure. Oh, I forgot to mention one important parameter, and that's blood sugar. A fasting blood sugar over 100 is pre-diabetes, and over 120 is considered diabetes. Now, if you are pre-diabetic, you are essentially on the diabetes side of the coin. So you want that blood sugar that fasting blood sugar well below 100. In fact, though 95 is good, 80 is much better. A few years ago, I had my numbers tested, and I was a little surprised because my cholesterol numbers, my HDL was really high. And you know, they tell you your LDL, but they don't tell you your oxidized LDL, which would be a little bit more helpful. My cholesterol had gone down significantly, but was not as low as I wanted it to be. And then I thought about that, and I thought, you know, you have lost 110 pounds. That is a fabulous thing to celebrate. But I still have some fat on me. And this fat is animal fat. This fat is saturated fat. So recently, I've lost another 5 pounds. Yes, go team. And I feel much better about life and hope that I can get my weight down just a smidge more. And it's not a vanity thing. People tell me I look great, and according to the US of A, I do. But it is a health thing. I need to make sure that all fat in the heart and the arteries has resolved. And you don't get fat off of one part of the body without getting fat off another part of the body. So I still have a little work to do when you look at the dimensions of my waistline. But the good news is my blood pressure is normal and my weight continues to go down to where it needs to be. I'm very short, so it probably needs to be about 118. But I am getting there, which means I'm more protected than if I wasn't. I might be a tad overweight. Though a lot of people would disagree with that, but obesity, I have changed that part. And luckily, I have never smoked because I know that is so addicting. It's hard to walk away from. In other words, when you eat a plant-based diet of high nutrient foods, you become protected from heart disease as well as other comorbidities. If you look at the research of Dr. Dean Ornish, even in the 1990s, though we're seeing even better results today than we were 25 years ago, but he was demonstrating, and Dr. Esselstyn, people who were compliant with eating a high nutrient diet reversed their heart disease. Isn't that fabulous? I love reading Dr. Furman. He has a wonderful book about reversing heart disease, and it's really quite interesting. But he has had clients, and I realize these are case studies, but he has had clients come to him, and they're at their wits' end, and they have severe angina and shortness of breath, and they can't even walk hardly from one room to the other of their home. They are miserable, and they're told they need bypass surgery or a stent or some sort of process like that. And if that's all that's available to them, that's probably true. However, they went to see Dr. Furman, and he said, if you do what I tell you to do, and by the way, within the time that you are set up for testing, diagnosed, receive a procedure, and have to go through cardiac rehab, in that time or less, he has almost totally reversed the heart disease, and his patients are up walking around, running marathons. My goodness, they're all crazy. But then again, life is much more fun that way. So I hope you enjoyed this, or maybe there was something here to assist you in your health journey. I just know that since I have been concentrating on my G-bombs and other vegetables and fruits are now the most delicious dessert on this earth. I just love that point in the day. Anyway, that I have totally changed my health. I feel great. I feel full of vitality and energy, and people can't believe it. But it's absolutely wonderful to be able to go do what you want to do when you want to do it, and not feel like you're change your refrigerator because you're constantly hungry. So here's to the end of chronic disease in your life. Thank you so much for listening, and remember, self-care is so important. So find that which works for you, because you are so important to the rest of us. So with love and appreciation in my heart, please take great care. And by the way, happy Halloween. Goodbye from Nurse Mary Jo.